We're live. All right. Welcome back, everyone. I'm Dr. Candice Jones. I'm a board certified pediatrician here in Orlando, Florida with Edgewater Pediatrics. Today, we have 4 community leaders here to talk about what is changing in their sector as they become trauma-informed and resilient organizationally and in how they treat the people they serve. What we now know from neuroscience, the science of ACEs and resilience impacts how every sector group in our community operates and works with people. It can no longer be business as usual. We know that the culture of punishment is ineffective, and we are moving toward a culture of connection. Whereas before we wondered or even asked out loud, "What's wrong with you?" Today, we are trained to ask, "What happened to you?" Imagine the impact across the sectors of health, justice, government, and education when we work in concert toward this paradigm shift. Today, on our panel, we have Sheriff Dennis Lemma. He is Sheriff of the Seminole County Sheriff's Office. Mayor Jerry L. Demings. He is the Mayor of Orange County Government. Deputy Superintendent Thomas Phelps. He is the Deputy Superintendent of Human Services for the Osceola County School District. And finally, Dr. Adaobi Okobi. She is the Medical Director of Teen Xpress, Child Advocacy Center at Orlando Health. Thank you all so much for being with us today. To our audience, you can find the panelists' full biographies in the conference program. Also, please put your questions in the chat as we will try to ask some of them to the panelists if time allows at the end. My first question is the same to all of our panelists. Can you talk about the innovative work you are doing in your sector to advance a trauma-informed, resilient community? I'll start with Sheriff Lemma.
Well, thank you so much, Dr. Jones. Great seeing you, and thank you for having me. You know, I think that this is an interesting time in our country and our communities, and from the criminal justice perspective, I think that we have long recognized that crime is a symptom of another problem. In my nearly 30-year career, I've never met somebody that's born and raised with the desire to be incarcerated or involved in heavy criminal activities unless there was an underlying condition that led people down that path in the first place. And this is why here at the Seminole County Sheriff's Office and more innovative and progressive law enforcement agencies across the country, you'll see us spending a significant amount of time to treat those underlying conditions, whether it's substance use disorder or mental health or early adolescent programs. Those are the key focuses that we look at right now. I think that one of the largest pushes we've had both here locally and across the state and nation is the work that we're doing to combat substance use disorder. We see record numbers of overdoses. I know you had a presentation about our partnership with Advent Health, Hope and Healing, but we do this regionally. We do it with Mayor Demings' teams. We do it with all of our healthcare providers, the business community, the faith community, to really come together and do what the greatest responsibility of any civilized society is, and that's to protect and preserve human life. We've recognized that up until this point, many of these problems have been treated in their own separate spaces. Mental health treats it in one space, substance use disorder treats it in another space. So we're working to combine all of those efforts to make sure that we get people healthy and whole and ultimately save lives. And I'm incredibly impressed with how many generous people have devoted their time and effort and energy. And in a very, very, very partisan world, it feels good to be a part of something where everybody can come together in common interest and make a difference. So that's kind of what we're working on, what we're focused on. And we know that if you are the victim of abuse, if your parents are incarcerated, you are more than 8 times more likely to engage in maladaptive behavior yourself. So we're not only helping the individuals, but I would argue that we're helping generations to follow down the path.
Thank you so much for that, especially approaching things from that trauma lens, and that crime is a symptom. That's great. Mayor Demings, please tell us about your innovative work?
Well, first, let me just say good morning to you, Dr. Jones. It has been my privilege to have worked with you on a number of different occasions at this point, and certainly I know our other panelists today as well. I'm honored to be on this august list and body of speakers today. Here with Orange County, we do recognize that to be the type of community that everyone wants us to be, embrace those that we have, the various cultural the underlying issues that community, and becoming a more transformed and resilient community is one of those areas to have some revamp some of the strategies that we have used historically. We are working with the Orange County usually receive the support of the Board of County Commission and rolling out a behavioral response unit in which he will be coupling licensed mental health professionals with deputy sheriffs who will respond to certain calls for service involving mentally ill. And I look forward to seeing the data as we move forward to how we are able to improve the system of care for these individuals so that they get the treatment that they deserve to receive. Going back to April, the Orange County created the Central Receiving Center here as a county community supposed to divert individuals who commit minor violations of law, issues or concerns.
So I'm not sure what happened there. I imagine they're backstage getting the sound better with Mayor Demings. So we'll come back to him and just move forward. Hopefully we're still going live here. So Deputy Phelps, can you please take that question? Tell us about the innovative work you're doing.
Certainly. And greetings and thank you, Dr. Jones. I appreciate the opportunity to provide a brief overview of some of the great things that we're doing in Osceola School District to support trauma-informed care. The school district actually started our journey towards trauma-informed care back in 2008 when we were awarded a Safe Schools Healthy Students grant. Recognizing the need to address the social, emotional aspect of a child, this grant allowed us to specifically identify students who have experienced trauma in their lives and to develop a system of care for the students to access mental health services. Through this grant, we were able to work with our community partners, and we have over 14 cooperative agreements with our local providers. These providers, with our cooperative agreements and also parent permission, are allowed access to our schools to provide therapy for our students while they're on campus. Teachers, school counselors, and school social workers are trained in trauma-informed care and aware of what to look for with our students and know how to refer a student for additional services. Discussions are held with parents and with school district, with workers and with parents and agencies to ensure that services are received in a timely manner. We also have developed through our student information system a way to identify students receiving extra assistance so that staff know to be aware of these students and their additional needs. For our littlest learners, we have piloted a program last year and have continued it this year, and it's a partnership with Park Place Behavioral Center where students who have experienced extreme trauma and are, again, our littlest learners, and they haven't been successful in the current classroom setting, are able to attend a unique classroom environment where there are mental health and behavioral interventions full-time in the classroom. This setup, along with the wraparound services for our families, has proven to be very successful in helping the students work through the effects of their trauma, making it better for them and getting them better able to access the learning. Our students also participate in the survey. It's a panorama survey several times a year, which helps us to identify the social emotional needs of our students. Our school counselors and school social workers use this data to develop programs, lessons, and interventions to address the student needs. All staff have been trained using Cognito, which is an interactive online training for mental health information. It is up to all of us to understand the trauma-informed care that many of our students are grappling with and the mental health concerns, and we need to be able to address them. This includes our deans, who work, pretty much, one-on-one with students who are experiencing discipline concerns. And our deans are trained on how to recognize when a student may be in need of additional services and to assist the student toward these services, oftentimes in lieu of a disciplinary action. The hope is to get to the root of the issue. Teachers, administrators, and staff are very concerned about the social emotional needs of our students. These are just a few things that we're doing in Osceola School District. I believe that we're really working closely with the social emotional needs of our students, and we want to make sure that we're giving every child every chance every day here in Osceola County. Thank you.
Thank you, Deputy Phelps. As a pediatrician, hearing teachers being trained in trauma-informed care, engaging our students in social and emotional learning, and also avoiding punitive responses to misbehaviors is so powerful and heartwarming. So I thank you for that work that you're doing there in Osceola County. I'm going to go back to Mayor Demings. I heard him say something wonderful about mental health and sheriffs responding together when things go wrong. And then you started to fade out. So you can pick back up and we'll give you a few more minutes to finish up your comments.
Well, I apologize for that. I continued to talk. The screen went blank. But in either case, we're working with the Orange County Sheriff John Mina, and a new program, a behavioral response unit. And they are deploying deputy sheriffs in tandem with licensed mental health professionals who will respond to calls into the community involving the mentally ill. We hope to be able to divert individuals away from the criminal justice system into treatment. Going back to 2003, Orange County created the Central Receiving Center here. In 2008, our jail population spiked at about 4,900 inmates in our jail on a daily basis. Today, that number is about 2,400. Largely, I think, as a long-term strategy, by getting people into treatment as opposed to incarcerating them. The jail isn't the best place for mental health treatment. But at that time in 2003, about 40% of our jail population on any given day was on some form of psychotropic medication. But with treatment, we're able to cut down on recidivism. And so it really is more of a compassionate, I think, and the right thing to do as we move forward. We look to expanding some services within our community through that. We're fortunate to have problem-solving courts where we're working with the judiciary. We have problem-solving courts that include a drug court, early childhood court, mental health court, and veterans treatment court. These are proving to be proactive measures that are being put in place to better provide for the system of care for those who have been trauma involved. And we, in the very near future, will be doing a system-wide review of the mental health treatment system that we have here within our community. We'll be working in collaboration with our hospitals, with the courts, with law enforcement, with treatment providers and others to do a deep dive into what we're doing today because I believe that there's a lack of coordination amongst the different sectors and how we are responding to mental health treatment and those who are trauma involved within our community, that results in unintended consequences like increases in the level of homelessness within our community. And so we want to be bold and perhaps look at re-engineering how we're organized. And before we say we're going to devote additional dollars to it, we want to make certain that the dollars that we're spending today are being spent most appropriately. So you'll hear more about this as we will work with a consultant team on that.
Thank you so much for those comments. And I've enjoyed being a part of the work you're doing as a pediatrician in Orange County. The community task force to address, some of the violence we see in the communities and just to build the community. And I love that you're addressing root causes, as everyone in this panel has mentioned, and doing cross-sector work to find solutions. So thank you so much for your work, Mayor Demings. Now we have Dr. Okobi Adaobi, and please tell us about the innovative work you guys are doing at Orlando Health Teen Xpress. I think you're muted.
Thank you, Dr. Jones. It's an honor to be here, and I'm really excited about the work all three of the other panelists are doing in the community. As a general pediatrician here in Orlando, I'm really excited to be part of this work. As the medical director of the Teen Xpress program, which serves our higher risk at needs communities in middle schools and high schools here in Orlando, I'm really excited about this because we provide our services directly in the schools with kids who have limited access to medical or mental health care. As part of, it's under the umbrella of the Child Advocacy Center through the Howard Phillips Center. And the other pieces of that program are highly important. Through the Healthy Families Orange and Healthy Families Osceola program, which is an evidence-based program that helps to address adverse childhood experiences for children. They actually provide home visits directly in the home with families who are high needs, generally in the younger younger children. So we're talking about mothers who can access our program towards the end of their pregnancy, up until their child is 3 months of age. And so we try to capture them really early on in their parenting experience to really reinforce childhood bonding and try to break the cycle of violence that so many of these women have experienced in their lives, and try to prevent abuse and prevents the Department of Children and Families being called to sort of intervene with these families' lives. We also, as part of our Child Advocacy Center, work with the Healing Tree, which is actually another evidence-based program, which really focuses in on providing group therapy for children who've experienced trauma. And these typically are kids who've experienced either physical, sexual, or emotional abuse. And so we have therapists who are available for group therapy for both the children themselves, as well as for the non-perpetrating parents or guardians who are involved. And so it allows for us to have healing on both ends, because it's very important. The children experience trauma, but a lot of times there's some measure of guilt and other negative impact for the parents or the other family members who are also part of this sort of cycle. Part of our goal at Orlando Health and part of our goal at the Child Advocacy Center is to really address needs for the family across the spectrum. And so I'm really excited about doing this work because it allows for us to see pregnant women, children from the very young ages, and we're also seeing kids all the way through their middle and adolescent years, and trying to intervene with them and making sure that they have access to good medical and mental health care to try to prevent them from showing up to see Sheriff Lemma or even Mayor Demings. And so we're trying to really stop the cycle of violence and stop the cycle of other traumatic childhood events and try to get these kids on a path to success and bring their families along as well. And so through the Healthy Families program, we have parents who are offered parenting classes. They're offered opportunities to help nurture their children and create bonds with them, but also to help them get their GED if they've dropped out of high school, help them find a job to really get out of poverty. So we're really doing a lot of great work here.
Thank you so much for those comments, Dr. Okobi. Again, as a pediatrician, the kids are our future. And the work that you guys are doing at the Child Advocacy Center is empowering families, building family health, especially with that parenting piece on helping parents to develop positive strategies to build strong kids. So that's great work. Thank you so much as a colleague in medicine. I appreciate you. So my next question is going to be more specific to your sector. So we'll start back with Sheriff Lemma. We have seen children as young as 6 years old be arrested in our region over the last couple of years, and the teenager having her head slammed to the ground by a school resource officer. Should SROs be trained in trauma-informed practices? And how do you see this work informing better discipline practices from our SROs in our schools?
Well, the easy question there, and the answer is yes, absolutely. It's not only critically important that the people who are interacting with our kids are properly trained and receive that training on a reoccurring basis, but that they have the passion to serve and understand what we're dealing with. The fact of the matter is, being one of the 7 counties here in Seminole County that takes exclusive responsibility to investigate abuse, neglect, and abandonment of children, we know that many children hold that inside and have no idea. So anytime you see any signs of behavior or interaction, the first question that those professionals should be doing is asking, what has this child been exposed to that would result them to act out in this type of way? Whether it's through victimization, especially when it comes to sexual deviancy and that type of stuff. More often than not, you'll find that these children also have been victims. But I think as important as that, you have to find school resource officers that are going to work in that environment, that are passionate about that work. You just can't fill the spots with people who are not incredibly passionate about providing safety and security and quite frankly, much, much more. When you find those right law enforcement officers there's a biological effect. Endorphins are released in the body, and all of these things make you feel better about yourself when you can help a person going down that path. And more globally, and I think that you've heard it from all of the panelists, but you can't arrest your way out of some of these problems. You have to divert people from the criminal justice system to an environment that they're going to get the help and the resources and the services that they need. And that's where you'll find is again, populations of incarcerated communities going down, but yet there's still a need to fix what I call a broken Baker Act system here across the state of Florida. There's no reason for children, in many cases, to be Baker Act 5 or 6 times per month. And when they're taken in an involuntary Baker Act, a lot of the times the law enforcement officers are frustrated that before they even do their paperwork, they're being released. Well, the argument there is they're being released because they were never intended to go there in the first place. Baker Act wasn't intended to accept any child or person in crisis. It was intended for those more extreme situations that are going on. And to the point that you're seeing now, court-ordered assisted outpatient treatment or treating people in their home in comforting environments is the best strategy. Unfortunately, it hasn't been properly funded through the legislature, and many states actually don't use it, or many counties in the state don't use it. So there's a lot of growth there. The Orange County model that John Mina is doing, where there's this collateral response, is a wonderful thing. Crisis stabilization centers, getting the people the help that they need is so important. And when you're dealing with the most vulnerable of populations, particularly our kids in school, the stakes are even higher. We send all of our school resource deputies through this training before we ever put them in a school.
Thank you so much for that. I'm usually the one in the chat going, amen, preach, yes. I'm sorry, I lost my professionalism there for a second, but that was an amen, okay? And some people in the chat are saying the same thing. So we really appreciate those comments, Sheriff Lemma. So Mayor Demings, we have 5 or 6 zip codes in Orange County that have struggled historically over many years with the social determinants of health, such as poverty, crime, education, housing, etc. How might this movement to become a trauma-informed and resilient Central Florida finally make a systemic difference for people living in these communities?
Thank you, Dr. Jones, for that question. Yes, we have found ourselves at the crossroads at this point where we are seeing the results and outcomes of systemic racism in some ways within our country as it relates to how individuals have been redlining with real estate values that created neighborhoods where there was poverty, where there was a lack of quality educational programs, where there were health equity issues and concerns, to high dropout rates and other things that really translate sometimes into high crime rates. And to me, crime is a byproduct of all of these other social problems that have gone wrong in a society. So as mayor, I get to look broadly and bring a multi-pronged approach to trying to solve some of these issues. Recently, going back to the fall of last year, within about a 3-week period of time, we saw several deadly shootings within our community, one of which resulted in the death of a 3-year-old child. And that was sad. So I impaneled a citizen safety task force here within Orange County to address the concerns that we were seeing, and with the purpose of reducing gun violence and violent crime within our community. And the task force focused on 4 pillars. The first pillar of prevention, the second intervention, enforcement, and prosecution. And so with the best way to stop crime from happening is to prevent it from occurring in the first place. And by addressing some of these social issues, becoming a better trauma-informed community and saying, okay, what happened here? Why are we seeing young people hanging out on the streets or joining gangs, and trying to understand that? And so what we did through the task force, this 37-member group of individuals met about 52 times over about a 3.5-month period of time. And they developed recommendations. The recommendations focused on increasing access to prevention and intervention programs for youth, having trusted voices and trusted places where youth could go to have positive interactions, focused on supporting smaller grassroots types of organizations to do this. It focused on increasing awareness and training on trauma-informed care and adverse childhood experiences. It focused on implementing mental and behavioral health for youth and families. And then lastly, it focused on expanding the use of civil citations by law enforcement and other diversion programs. And I want to thank Rachel Allen, the Executive Director of Peace and Justice, the Peace and Justice Institute, for her work on the task force and her focus and education to the task force on trauma-informed care. And so as we move forward, Orange County government has endeavored to spend about $2 million focused on new programs so that we will have community-based organizations that would address some of the underlying issues that we're seeing with our youth. Orange County also commissioned a study, a consultant study about 3 years ago to take a look at the high dropout rate, high unemployment rate, high rates of incarceration for youth, the disproportionate impacts on people of color, et cetera. As a result of the study, when they looked at the 53 zip codes throughout Orange County's 1,000 square miles, 9 zip codes seem to have the focus of where we saw the biggest brokenness, if you will, amongst our teenagers and young adults. And so we endeavored to spend an additional $20 million. At that point, Orange County was spending about $67 million on youth-related programs. So the additional $20 million, we said we wanted to go to organizations that would, through an RFP process. And when the RFP went out, there was language in there that said that they had to have programs that would address trauma-related issues within the community. And so we, with the combined $87 million that we put on the streets to these organizations that would be working with different individuals within our community to reduce teenage pregnancy, high school dropout, to improve graduation rates and all of these other things. We were well on the way, and then the pandemic hit. And because of the closure of schools, closure of certain facilities, and the restrictions related to social distancing, many of those organizations, quite frankly, could not deliver on what they had promised in the RFPs. And so we have extended many of their programs. And so we look forward to reporting back on how we have moved the needle with those particular outcomes. And then we're fortunate here in Orange County, we have the Primary Care Access Network, the PCAN clinics, which is a dynamic collaborative among Orange County government with healthcare centers and community agencies and hospitals and other social service providers to ensure that we are delivering quality and coordinated healthcare services within our community. You'll hear more about that going forward. Our Orange County Community and Family Services Department continues to look to leverage our relationships with community-based organizations who can provide the services that we are looking for. And so I would encourage any community-based organizations that provide social services to look at our website. We have a focused schedule of RFPs that will be coming out, and we look forward to you submitting. Of course, this is government money. So when we deal with government money, it's not free money. We do expect to have deliverables and measurable outcomes as a result of that. And so that is what I will tell you. We're changing our public policy as we're trying to become a better community, more resilient and trauma-informed community.
Thank you so much, Mayor Demings. Those are all promising programs that the community, our citizens, all of us will benefit from. And getting to that resilient community and trauma-informed community that we're looking for. So thank you so much for the work that you're doing. Deputy Superintendent Phelps, what are you doing as a school district to reduce extreme disciplinary actions for the students in K through 12, recognizing that children of color in our region and nationally are disproportionately impacted? What programs and practices have you implemented for teachers, staff, and students to create more connected, inclusive, and positive learning environments for all of our children?
Great. Well, thank you, Dr. Jones. I appreciate the opportunity to address the question. I think at least in the education sector, we can all recognize that everyone can continually improve when it comes to student discipline. And it should be a focus for all of us to problem solve student behaviors and to assess if it's due to a trauma or a mental health concern. Reducing exclusionary practice has been a priority for our superintendent and for our school board, and has been part of our strategic plan for many years. Some strategies that we've implemented are better training for our deans. As all of us will know, our deans are the ones who have that boots on the ground contact with our students. And so oftentimes, these deans are placed in these critical roles without really adequate training. So, working with them, giving them the tools, providing the training for these critical staff members helps to identify students who are in need of mental health services, and we basically give them the tools to be able to do that. So we feel giving deans the additional training on how to consult with and refer students for counseling services, how to identify these students and get them to an assessment as opposed to an immediate punitive action has been extremely helpful. In addition, we've worked with the University of South Florida for probably over a decade now with the Pbis Project. And for those who aren't familiar with Pbis, it's a positive behavior intervention and support. And basically what Pbis is, it's a set of ideas and tools that schools use to improve student behavior. Using data is a critical part of this, and what this Pbis teams do is that they review the data They look for trends in behavior, areas where discipline may be a concern, and they use that data to develop strategies and basically help to reduce discipline and exclusionary practice for our students. Another strategy in our schools is utilizing restorative practices in lieu of disciplinary actions. Restorative practice is still something that's a little bit in its formative stage with us. However, we do have quite a number of schools who have been trained and are working in restorative practice, and it's been proven to be very helpful in reducing the need for disciplinary actions, and more importantly, it's helped to reduce the repeat occurrences of misbehavior, which is what we're really trying to do. Finally, I personally meet with our leadership teams at our schools. These include our deans of students for the schools that have a dean. And our purpose there is really just to review school-wide discipline data, look for trends, and really dive deep into individual students and have discussions. It's basically about problem-solving conversations and what more can we do for this student. And finding out what is it that might have happened with this student to maybe cause these behaviors, and is there something that we can do to be a little bit more proactive and help to resolve the disciplinary issues. We've also done an equity study through our research and accountability department, and that study is helping us to identify areas that we may need to focus in on within our strategic plan, and to create some strategies that we might need to develop in order to address those specific areas. Again, through our problem solving, we are better able to meet the needs of our students. I want to thank Dr. Jones and the whole panel for allowing us to share some of the things that we're doing in Osceola. Thank you.
Thank you so much, Deputy Phelps, for your questions. And I really appreciate training everyone, right? Because anyone who touches the life of our children need to be trained in a way that empowers them, but and be held accountable for that. So thank you so much. We're running a little behind on time. Dr. Okobi, this is your next question. The Children's Advocacy Center at Orlando Health has been leading in trauma-informed practices for many years. What are the challenges of bringing this work to a wider hospital platform, especially during a global pandemic?
That is a really great question. Thank you, Dr. Jones. I think we have to take a step back. One of the most important things is to realize is that hospitals are meant to be places where people go in emergent conditions. So having our hospital system be built around the injury in the acute setting, as opposed to sort of the long-term work that needs to be done from the mental health capacity as well as the physical capacity, and making sure that there are enough resources available to have all of these programs running at the same time. I think that's really important to recognize. So I think that's one of the biggest challenges, is that the work that a hospital is meant to do is sort of different from the work that I think we think of when we think of adverse childhood experiences. The other thing is that in the midst of this pandemic in particular, we had a lot of things that were kind of happening on the forefront, a lot of frontline workers getting burned out, a lot of people becoming sick, many people dying, as you guys all know. So this made it extremely challenging to have ACEs be the forefront of what we do, when we were just trying to make sure that we could save people's lives that were acutely injured or acutely ill at that moment. So I think that's something that, juggling. But the other thing is, people need to be aware of adverse childhood experiences. And I don't know that the broad community is aware of all of these things. Dr. Nadine Burke-Harris has been doing really great work. And I re-watched her TED Talk, which is amazing if you have a chance to do so. And just bringing home the fact that, if we had an epidemic of people dying from heart disease, we would be looking at what's going on. We have that sort of epidemic, but I don't think it's the same thing. I think when people look at, these experiences that people have, we're talking about 67% of the population has at least an ACE score above 1, right? That's 2/3 of people. So that's a lot of people. And I don't know that people think about it that way. So I think we need a broader awareness within our community to really address these things. And then the other thing, we need the resources there. I think it's really difficult to ask overburdened mental health workers to take on yet more burden of people feeling more anxious, more depression, more anxiety, I should say, more depression, and other ills that are coming about now after people have been, quarantining for the last year or so, and people are over it. So we need more people in our system to really be able to access the mental health care that they really need. And I think that's been really challenging. And so I would love to partner with you, Mayor Demings, Sheriff Lemma, Superintendent Phelps. I think that the work that we're doing needs to cross spectrums and not just be in a silo of medicine or in a silo of the criminal justice system or education system. I think we need to really create bridges that cross the span of healthcare and all of these other atmospheres of society so that people can get the help that they need in whatever aspect that they access the system from. So that's been, I think, the biggest challenge is sort of just getting that information out there, finding the resources to deal with it, and hopefully preventing people from seeking the care that they need. I'm hoping that we can get people before they get to the point where they're so sick, they're so ill, that there's not a whole lot we can do. We spend a lot of our time, and this is a societal thing, a lot of our efforts go into saving people in their last moments and throwing everything at them when they're at death's door, and not as much emphasis goes into preventative measures, like getting your well child visits, like getting your immunizations, like getting vision screening and hearing tests and all of the things that pediatricians do and primary care physicians do. And so I think that's going to be really important for us to pool our resources into the places where we can capture the most people without as much expense to the system, so that we can really focus our efforts to gather as many people as we can and bring them along the way. So thank you.
Thank you so much, Dr. Okobi. I just wish we had more time, guys. This is so good. So I think we have literally like 2 minutes to try to ask one question. I wish we had more time, and then we're going to have to wrap up. So I saw a great question, not that all of them weren't great, from Adam. Where is it? Adam Hartnett. Let's talk about, you had a couple of questions, Adam. Let's talk about prevention. How do we eliminate, the screen keeps moving, how do we eliminate the perceived need for student resource officers in school? And this is something that comes up in pediatrics all the time. Do we really need SROs? And Sheriff Lemma and even Mayor Demings could speak to that in the last couple of minutes that we have. Well, 1 minute now.
So I'll go first, and I'll try to take 1 minute so the mayor can answer the last portion of it. I think that the better argument is to make sure that we have the right people in those schools, and that people recognize that a primary role of a school resource officer on a campus is not necessarily school safety and security. I mean, that's a top priority, but if we can foster real and meaningful and productive relationships between law enforcement officers, I think that law enforcement agencies are trying to recruit a more diverse workforce that looks like the populations that they represent. And I think that there's good to come of that, to teach kids about all of the dangers associated with the drugs that are being seen now. Lastly, I'll say that we have to come together, because as we've been wearing masks and going into personal isolation, and now we're getting more vaccinated, the problems of these underlying conditions are even going to be greater when we come out of this. A lot of times the only meals that children get are at school. A lot of times the first person that will see signs of abuse, neglect, or abandonment are those mandatory reporters, those school teachers. So when the smoke clears and we can come out as a healthier community, there's going to be a lot of work to do in this space. Thank you so much for having me on.
Thank you guys so much. I'm so sorry. We're going to have to end. I'm being held here. I've been doing multiple things to wrap up this panel. Thank you to our panelists and to our audience for engaging in this conversation. There are so many wonderful questions and comments in the chat. I really encourage you to look at them and think about them. And so this is the time for us to practice. What happened to you? not what's wrong with you. And now we will transition to our second panel, our Collective Impact Regional Resilience Networks. Please allow our tech team 1 minute to get the next panel on stage. Thank you all so much. Wonderful panel. Wonderful guest.